With San Francisco having one of the highest caseloads of monkeypox in the whole country, Senator Scott Wiener is calling on both the city and the state to issue a state of emergency. KRON 4's Rob Nesbitt talked to the senator today about how that might improve things like testing and vaccine supply. And Rob joins us live in the newsroom. Rob.
San Francisco and Los Angeles go back and forth with having the highest number of monkeypox cases in the state. Senator Wiener says that's concerning when you consider the difference in population between the two cities. With supplies running out, the U.S. announced Wednesday that 800,000 more doses of the monkeypox vaccine have been approved to be sent out to states in need of more. The shipment coming from Denmark. But Senator Scott Wiener says the Food and Drug Administration should have acted sooner. It's why he's calling on San Francisco and California to declare a state of emergency.
Creates flexibility for administering vaccines and expands who is able to actually administer vaccines. It also expedites entering into contracts with providers.
Senator Wiener says additional funding would also remove barriers around monkeypox testing, important when it's assumed that there are more positive cases of the virus than are being reported.
We're a city of 800 or 900,000 people, and we're being impacted, per capita more than New York City, far more than LA.
The U.S. is considering issuing an emergency following in the footsteps of the World Health Organization. Dr. Peter Chin Hong at UCSF says the action at the federal, state, and local level will result in a more well-oiled machine for healthcare providers.
The administrative help, you need to fill out the paperwork to get treatment and to follow up patients. That requires additional funding. The public health response to track people on contact trace, that requires a lot of people's time and funding.
The San Francisco Department of Public Health started making calls this week, canceling appointments for second doses of the Jynneos vaccine in order to prioritize first shots for more people at risk, a move that the doctor supports.
The first shot is really acting like 2 shots of a Pfizer vaccine, and the second shot is acting like a booster. So the booster you don't need for several months, if not longer.
The Zuckerberg San Francisco General Hospital monkeypox vaccine clinic was closed again today because of a lack of supply, but the San Francisco Department of Public Health was informed today that the city will be receiving more than 4,200 doses by the end of the week. Reporting in the newsroom, I'm Rob Nesbitt, KRON 4 News.